And here we go. Welcome everybody to The Big Idea. I'm Dr. Jeffrey Hanna, and I've got a very short one, but a really important video for you here today. Always make sure that when you are seeing a specialist, they're not just reading your report, whether it's a blood test, an x-ray, an MRI report, that they are actually looking at the numbers or the images as well. There's an article I'm going to show you here. I've been sitting on this for a couple weeks because it's been a little long. I haven't been able to get to the camera here. But really important concepts that are dealing with the upper part of the neck and how often this area is actually underdiagnosed. Let's jump to it. Okay, I'm going to try to make this one short and sweet. Is the atlantoaxial level, so C1, C2, overlooked in the radiologic interpretation of cervical MRI? So the purpose of the study was to quantify the rate at which the upper neck, arguably the most important area in the spine, is omitted from MRI reporting and, as a result, missing pathology. So what these researchers did here was they had a look at 219 patients at 101 different institutions with 126 different radiologists. Check this out. So let me zoom in just a little bit more there. Specific documentation of C1, C2 evaluation was noted only about 15% of the time. 85%, it wasn't commented on at all. And that's not just saying that there was, discrete pathology at that area, but they made no comment whether it was normal or not. And this, unfortunately, is a very, very common issue that happens when people have an MRI of the neck, is that they're looking typically from C3 down, but even a brain MRI, sometimes you can see the upper neck, but usually they say, well, stop right there. So this critical area of the body, for all the other reasons that you can see on the other videos on this channel, this goes uncommented on in a huge percent of the time, 85% not commented on. So the researchers here, they took it one step farther. So they, upon independent re-review, they went back and looked at all of these images and they found discrete pathology. So this would be something like a broken bone, a tumor, a lesion, ligament damage, instability, something like that was noted at that level in 8% of the cases, with a total of 19 findings. So these findings were absent from the official reports in 6% of the total cases. So again, we're talking about there was discrete pathology that was missed in 1 in 19 people, let alone all of the functional disrelationships, the thing that I talk about on this channel all of the time, where you can see ligament damage, where you can see disruptions in cerebral spinal flow, where you can see constriction or narrowness of blood vessels. We're not even talking about that kind of stuff. We're talking about like the big stuff that could potentially be really, really bad for you. Now, this is not to blame radiologists by any stretch of the imagination, but what it means is that for any person who is a specialist in whatever your own field is, you need to make sure that you're actually looking at the test results yourself, because it's good to have two sets of eyes looking at the same thing. Otherwise, the report comes back saying normal. But even more important for that, if you are a person who's experiencing different kinds of issues in your body, and you go to see a specialist, it's not an unreasonable request to ask that they actually look at the numbers, look at the images themselves so that they can form their own opinion. Not simply trust what's written in the report, because again, that area, especially if you're dealing with upper neck, that may be completely not commented on 85% of the time. So there we go, under 5 minutes. That quite very well could be a record for me, but really short to the point. Always make sure that if you're working with a specialist that they're actually looking at the images or your test results to know what's going on and getting that second set of eyes on it, because oftentimes some of those subtle little things might be missed on the official reporting. So if you've enjoyed this video here, please make sure that you click that like and subscribe button. That way other people who are looking for this kind of information might be able to find it. Please be sure to also check out many of the other videos that I have on this channel that actually point out some of the different things that can be going on a person's imaging so that you can actually find what's going to be the right treatment that can help you out. And if you want more information, you can check out our clinic website, which is clearchirospokane.com. Thank you guys very much for watching. This is Dr. Jeffrey Hanna, Clear Chiropractic. Get well, live well, stay well.